Hi, continuing with ACL tears brought to you by Knee Rehab Pros and KneeFitandFive.com. So after I diagnose someone with an ACL tear, what happens next? Well, the first thing we have to do is get rid of the swelling and we have to get their knee functioning again. So the first thing we do is work on some of the exercises that we've already reviewed. We got to get their terminal extension back, heel props, and towel pulls. So then we also have to get their quads to wake up because their knee will get swollen. That makes their quad muscle, remember this muscle that inserts up here and pulls their knee straight, we have to get that to wake back up. So we get that to wake back up, we work on extension, we work on bending, and then we have to work on flexion and gait training, getting them to walk normal. So once we have a person walking normally and their quads awake and they have full extension and getting close to full flexion, so what's next? So the next thing to do is to start working on some single leg strengthening. Again, a lot of the exercises we've already talked about, doing some squats, doing some step ups, doing some lunges, those type of things to help get the strength back. What's safe to do with an ACL tear is inline activities. Walking, jogging, cycling, weightlifting, all those are very low risk type activities to do, and with an ACL tear they're quite safe to do. So once your knee is rehabbed after an ACL tear, what's next? Well, the conversation then goes to, should we do surgery or should we not do surgery? Why would you do surgery on an ACL tear? So the ACL tear, remember with tears, when you plant, you bend, you twist, so it's a flexion twisting thing like this, and your knee twists funny, and that's what tears your ACL. Well, the ACL's job is to prevent that twisting from happening as you're doing landing and jumping. The problem with that twisting activity is it can lead to meniscus tears. And the problem with meniscus tears is that possibly could lead to arthritis down the road. So people talk about ACL surgery to prevent the meniscus tears and to prevent the arthritis down the road. So that's why we talk about ACL surgery. So who needs surgery after an ACL tear? So people whose knees give out, plant twist, knee buckles on them, those are people that need ACL reconstruction. Who else? Athletes that are going to be performing those high-risk activities. By high-risk, I mean people that plant twist, soccer players, volleyball players, basketball players, people that are cutting and twisting. Again, the problem is if your knee buckles, plant twist, gives out on you because the ACL is torn, you run the risk of tearing your meniscus. So the surgery is to prevent that tearing. So if you're in a high-risk activity or your knee's buckling on you, then those are good indications to have ACL reconstruction. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.